Hello everyone. Today's lecture will be about reversible and irreversible cell injury. This lecture will include reversible injury, irreversible injury, which we call it also necrosis, the clinical implications for irreversible injury, and the patterns of necrosis. To start with, cell injury is divided into reversible injury and irreversible injury, and this distinction is based on that when the injurious stimulus is removed, the cell in reversible injury can go back to normal. However, the cell in irreversible injury is at the point of no return. So even if we remove the injurious stimulus, the cell will not go back to normal. So as you can see here at the top, we have the normal cell, which contains many organelles, as you know, like the nucleus, endoplasmic reticulum, ribosomes, mitochondria. And when this cell is exposed into an injurious stimulus, it will undergo first the reversible injury. And reversible injury, as you can see, the main difference is that the cell is swollen and we have membrane blips and membrane bulgings. The cell is swollen because of the accumulation of water inside the cell. And there will be also swelling of the different organelles inside the cell, like the endoplasmic reticulum, the mitochondria, with the appearance of some black densities, as you can see here in the mitochondria. But as you can see also, all the organelles and the membranes are still intact. The nucleus is there. And as I said, when the injurious stimulus is removed, this cell will go back to normal. But what happens if the injury is progressive or the injury is prolonged or the injury is so severe? The cell will enter into the irreversible cell injury, which we call it the point of no return. And the other name for the irreversible injury is necrosis, which means also cell death. So irreversible injury equals necrosis equals cell death. And the main difference, as you can see here in the irreversible injury, is that the cell membrane continuity is lost. So there will be discontinuities in the membrane, like أنا دايما بشبهها as if you have a balloon and you start filling it with water, the balloon will be increasing in size until the point of rupture. So when the balloon is ruptured, this is the point of irreversible cell injury or cell death. So you can see here, the cell membrane is disrupted, it's lost, and even the organelle membranes are also disrupted. The nucleus starts to disappear, and the cellular content, the enzymes inside the cell will leak to the outside, and we will have an inflammatory reaction in which inflammatory cells, mainly the neutrophils, will come to engulf these dead cells to remove them. So we'll have at the end an inflammatory response. This is in relation to necrosis, which is one type of cell death. The other type of cell death, which will not go through the reversible and irreversible injury, and it will be discussed in a separate lecture, is the apoptosis. In apoptosis, as you can see here, there are multiple differences from reversible or irreversible injury. First, the cell is shrunken. It decreases in size بدل ما تزيد في الحجم. This reduction in size is accompanied by an intact organelle membranes. With time, the cell will fall off, and that's why it is called apoptosis, because the cell will fall off زي عنقود العنب into small apoptotic bodies. Every body is a part of the cell membrane with enclosed cellular content of organelles or part of the nuclear material. At the end, the cell will disappear by a few inflammatory cells that will come to engulf the cellular debris, but without provoking an intense inflammatory reaction like in necrosis. So at the end, we have two patterns of cell death, which are the necrosis and the apoptosis. And you have to know the differences between these two patterns. So let's go back to the reversible injury. Now, if the damaging stimulus is removed, the injured cells will return back to normal, and this is the rule of reversible injury. In terms of morphology, we have always in pathology, we have macroscopic morphology and microscopic morphology. The macroscopic morphology, which we can see by naked eye at the level of the whole organ. The microscopic morphology, which we can see under the microscope. And mainly we are talking here about the light microscope. In addition, we have the ultrastructural changes, which can only seen by the electron microscope. The main morphologic changes in reversible injury are cellular swelling, as you see in the previous slide. The cell is swollen, and this will be also reflected by organ swelling. The second morphologic change is the fatty change. So these are the most important morphologic changes in reversible injury. To start with cellular swelling, why the cell is swollen? Because as I said, there will be accumulation of water inside the cell. The cell will تنفخ مثل البالون. As you can see here in this example, it is a section from the liver in which the hepatocytes are undergoing the hydropic change. Why we call it hydropic? Because it is of water content accumulation inside the cells. So the normal hepatocytes usually have a pinkish cytoplasm. بينما the hepatocytes that are affected by cell injury, they have a more whitish or bubbly cytoplasm. Why we have water inside the cell, we will discuss it in more details in the section of mechanisms of cell injury, because mainly of the failure of the sodium-potassium ATP dependent pump in the membranes of the cells. These pumps needs ATP, and in the injured cells there will be no production of ATP, and the cell will be non-functional. So failure of this pump leads to accumulation of sodium inside the cell, potassium outside the cell, and the sodium will attract water with it. So we will end up with a swollen cell. The second morphologic change is the accumulation of fat inside the cells. And this is mainly in the cells or organs that are involved in fat metabolism. As you can see here in the liver, it is reflected also on the macroscopic appearance. You can see here this section of the liver with fatty yellowish cut surface, greasy cut surface. The liver will be enlarged طبعا, and under the microscope it is reflected by the appearance of these lipid-rich droplets inside the cytoplasm of cells. We will also discuss why the fat is accumulated in the cells in the lecture of mechanisms of cell injury. So these are the morphologic changes. The other changes which are mainly seen by electron microscope, like changes in the plasma membrane, but I have to insist here that the membrane is intact, but we have blips, blunting in the membrane. The mitochondria also undergoes changes in the form of a swelling and the appearance of black densities inside the mitochondria. We have also dilatation of the endoplasmic reticulum, and with time راح يصير في detachment of ribosomes from the endoplasmic reticulum. We have also nuclear clumping of chromatin, but again, the nucleus is still intact and it is present inside the cell. The cytoplasm will contain some myelin figures derived from the phospholipids of the altered plasma membranes and organelle membranes. These changes are also seen sometimes in irreversible, injury, but they are much more severe. Now, in irreversible injury, which we call it also a necrosis, so they are synonyms, they are equal. We have three main features. These are the typical features of, or the defining features of irreversible injury. First, there will be irreversible mitochondrial dysfunction, and you know that the mitochondria is the ATP factory of the cell, so there will be no ATP production at all. And this is irreversible بحيث إنه the mitochondria will not go back to normal. There is loss of the plasma membrane integrity and intracellular organelle membranes integrity, and this will lead to leakage of cellular enzymes and even organelle enzymes and proteins to the outside. the organelle contents will leak to the cytoplasm, and the cytoplasmic contents will leak to the outside of the cell, and they can gain access also to the bloodstream where we can detect them by certain laboratory investigations. The third feature of irreversible injury is loss of DNA and chromatin structural integrity. So if you have loss of the membranes, loss of the nucleus DNA, and loss of the mitochondrial function, you will end up with a dead cell. In addition, we have a local inflammatory reaction. Always necrosis is accompanied by a local inflammatory reaction. The morphology of irreversible injury under the, mainly we are talking here about the electron microscopic findings. We have increased dilatation of the endoplasmic reticulum, increased dilatation of the mitochondria with appearance of mitochondrial densities, more myelin figures because we have more damage of the membranes and membrane phospholipids. So this will end up with accumulation of myelin fatty material inside the cells. Also, on the under the light microscope, we have changes that we can see by hematoxylin and eosin stain, which is the increased cytoplasmic eosinophilia. Why do we have increased eosinophilia? The eosinophilia means the pink color under the microscope, which is usually given by the eosin part of the hematoxylin and eosin stain, which is the main stain, the routine stain that we use it to stain our glass slide sections. This eosinophilia means more pink color. And why we have more eosinophilia in cases of irreversible injury? Because we have a lot of degraded proteins or denatured proteins in the cytoplasm which will attract and bind the eosin. And also we have decrease in the transcription and the translation and transcription of proteins in the cell because, as I said, it's a non-functional cell. So we will have decrease in the RNA content in the cytoplasm, and this RNA gives the cell some bluish color. Loss of this bluish color gives more eosinophilia، يعني الشغلة نسبية. Now, what are the nuclear changes that occur in irreversible injury? Because احنا حكينا إنه defining features هي nuclear damage, which is irreversible. The first is called pycnosis, which means shrinkage and increased basophilia of the nucleus. شو يعني basophilia? Basophilia means when you see the nucleus dark blue color under the light microscope on the hematoxylin and eosin stain. After pycnosis, we have karyopexis, and karyopexis means a fragmentation of the nuclear material, and at the end we have the karyolysis, which means degradation of the nuclear material and the fading of the nuclear basophilia. So we have these three events: pycnosis, karyopexis, and karyolysis. We can see them, by the way, by the under the light microscope on hematoxylin and eosin stain. So these pictures here shows you the spectrum of changes that occurs from the normal cells in the first picture. In the middle, we have cells with reversible injury, and at the end to the left, we have cells with irreversible injury. The main differences in reversible injury is that the cells are swollen. The nucleus, as you can see, nuclei are still intact. And in the last picture, we have loss of the nuclei in the cells. And we have cells that are left with the eosinophilic cytoplasm that is disrupted because the cell is also ruptured here. We have loss of the DNA or the nuclear material. Now, as I said, cell death occurs by two different mechanisms, which are the necrosis and the apoptosis. What will decide how the cell will die is the nature of the injury, severity of the injury, and the status of the cell. Necrosis usually occurs when the injury or injurious stimulus is rapid and uncontrollable. with severe disturbances, like, for example, when we have ischemia, cut off blood supply, when we have toxins-induced damage, when we have severe infections like viral infections, bacterial infections, and when we have severe trauma. In all of these events, the damage is rapid and the injury is severe, so we will end up with necrosis. The second pathway of cell death, which is called apoptosis, هذا بنسميه احنا cell suicide أو انتحار الخلية. It is highly controlled, highly regulated by genes and signaling pathways, usually associated with less severe forms of injury. يعني مثلا UV light induced sun damage to the cells, for example, aging of the cells, loss of the growth factor signals that reach the cell. These are minute or trivial injuries that will not lead to necrosis. It will lead to death by apoptosis, but it is very precisely controlled. It can be manipulated. We can use this feature to manipulate the death of cells in using some chemotherapeutic agents in the management of cancers. It can occur usually in what looks to be a healthy tissue, like when your aged cells of the skin die due to aging. This is called an apoptotic pathway of death. So we call it, the other name is a clean cell suicide, because as I said, there will be no inflammatory reaction at the site. Sometimes we have mixture of necrosis and apoptosis at the same time, so we call it necroptosis. Now let's talk about the function of the cell during the cell injury. خلينا نتفق إنه the injured cell سواء كانت reversible injury أو irreversible injury is non-functional. يعني loss of function is a feature of both reversible injury and irreversible injury. So as you can see here, the cell function will start to decline immediately after the onset of the reversible injury. However, the changes, whether the ultrastructural changes that occurs after cell death and reversible injury, the ultrastructural changes are the first to appear, but إحنا ما بنشوفها إلا under the electron microscope. Then the light microscopic changes will appear, and at the end the gross morphologic changes اللي بنشوفها by naked eye على مستوى whole organ. in terms of the duration of injury بدنا وقت أطول عشان تظهر الجروس macroscopic morphologic changes، بينما ultrastructural changes بتبلش earlier. Now this table is very important because it summarizes the differences between necrosis and apoptosis, which I already mentioned in the first slide. In terms of cell size, in necrosis the cell is enlarged, is swollen because of the increased water content. بينما في apoptosis the cell size is reduced, the cell is shrinked. The nuclear changes in necrosis involves pycnosis, karyorrhexis, and karyolysis, and I said, and in apoptosis we only have fragmentation of the nucleus into a small nucleosomes, and every part will go into an apoptotic body in order for the macrophages to engulf them and remove them. The plasma membrane is disrupted and destroyed in cases of necrosis, بينما it is intact in cases of apoptosis. That's why the cellular content or the enzymatic content of the cells can leak out in cases of necrosis. However, they are maintained inside the cell in cases of apoptosis. Adjacent inflammation is frequent in necrosis, however, it is absent. That's why we call it the clean cell suicide. Necrosis is almost always pathologic. There is no physiologic necrosis. بينما الابوبتوسيس راح تشوفوا في محاضرة الابوبتوسيس إنه في عنا we have physiologic forms of apoptosis and pathologic forms of apoptosis. So these differences are important, and this table is required. The clinical implications of cell injury, it is important to detect the site of injury because, as I said, when the injured dead cells have membrane dysfunction, the cellular content or cellular enzymes will leak out and they will gain access to the bloodstream. We can detect them by serum samples. For example, if we have a myocardial injury in the heart after cases of myocardial ischemia or myocarditis, we can detect or نتأكد إنه في injury by detecting the cardiac enzymes in the blood. عشان هيك when the patient comes to the emergency room complaining, for example, of chest pain, cardiac chest pain, and they think of myocardial infarction, they will go and check the cardiac enzymes if they are elevated. So there is some injury taking place in the heart. The same applies to the liver. The liver enzymes also will leak out to the blood in cases of hepatic injury, like in cases of hepatic toxicity by certain medications or the viral infections, hepatitis. So we can detect the hepatic enzymes, the AST and ALT in the blood to make sure that there is an insult taking place in the liver. Now we will shift to the patterns of the morphologic patterns of tissue necrosis, which will give us sometimes an etiological clues to the cause of necrosis. The first type of necrosis we call it coagulative necrosis. ليش بنسميه coagulative? Because the tissue architecture is conserved initially for a few days before the onset of necrosis that will cause before the onset of inflammation that will cause the damage in the tissue architecture. Now, macroscopically at the level of the organ, the coagulative necrosis area will appear pale because the underlying mechanism of coagulative necrosis is the loss of blood supply or ischemia. Ischemia to all solid organs, including the liver, the spleen, the kidney, the heart, will result in coagulative necrosis. ما عدا in the brain, it will result in another type of necrosis. So it's the wedge-shaped area of pallor due to cut of blood supply. Under the microscope, it is also a wedge-shaped area of anuclear eosinophilic cells. So the cells are devoid of nuclei لأنهم dead cells. وهذا اللي بنشوفه على اللايت مايكروسكوب. ليش بصير في عندي هالconserved architecture؟ لأنه الإسكيميا بتعمل لي enzymatic dysfunction للإنزيمز اللي موجودة في السيلز. So these enzymes اللي هي مسؤولة عن ال degradation وال damage will be non-functional، فرح تضلها الخلايا محافظة على شكلها for at least few days, 1, 2, 3 days before the onset of the damage and the inflammation. Because later on, when the blood supply comes back, the neutrophils and inflammatory cells will start the process of phagocytosis and the clearance of the dead cells. This is another example on coagulative necrosis here of the kidney. So as you can see, a wedge-shaped area of pallor microscopically, and under the microscope, you can see here on the right side, the cells with intact nuclei. بينما on the left side, we have the tubules here with lost nuclei. They are damaged. They are dead cells, but still محافظين على شكلهم because it's a coagulative necrosis just for a few days. The second type of necrosis is called liquefactive necrosis, and from its name, it is liquid form of material that accumulates in this type of necrosis. It is usually associated with focal infections by bacterial and fungal organisms, which are usually accompanied by the production of pus material اللي هي مادة العمل أو الخراج, in addition to ischemia to the brain or to the central nervous system, brain and spinal cord, will result in a liquefactive pattern of necrosis بدل coagulative necrosis اللي بيصير ببقية solid organs. So as you can see here, it's a cavitatory lesion in the lung, and under the microscope, it is characterized by collection of inflammatory cells, mainly acute inflammatory cells or the neutrophils. And the second picture تحت هي صورة من from the brain with a cavitatory lesion also corresponding to an area of infarction. Why the center liquefies? Because it is digested and is removed by phagocytes. The gangrenous necrosis, or what we call it gangrene, is a clinical term. It is basically a coagulative type of necrosis, but it occurs on multiple tissue levels. Yani, as you can see here, it's at the amputation of the distal part of the foot, in which it is a blackish. There is a blackish discoloration of the skin due to ischemic necrosis of the skin, underlying subcutaneous tissue and underlying muscles and underlying bone. So it is basically a coagulative type of necrosis, but at multiple tissue levels, which can be accompanied by a superimposed infection, in which we call it a wet gangrene زي الصورة اللي تحت, or come not accompanied by an infection, and we call it a dry gangrene. The other type of necrosis is the caseous necrosis, and this is classically seen in cases of tuberculosis. It is called caseous because of the accumulation of a cheesy-like material اللي زي ما انتم شايفين هنا لونها yellowish to whitish, cheesy-like material. The tissue architecture is not preserved anymore. It's not like the coagulative necrosis, and it is characterized under the microscope by the appearance of the acellular center of necrotic material, which is usually enclosed or surrounded by a collection of macrophages to form a structure. We call it under the microscope granuloma. So caseous necrosis characterized by cheesy-like material. Under the microscope, we have granulomas, and it is typically seen in tuberculosis. This is another picture for the caseous necrosis. As you can see here, this yellowish to whitish cheesy-like material in the section from the lung. The fat necrosis من اسمه necrosis of the fat. It occurs usually, the best example is in acute pancreatitis due to release of pancreatic enzymes, which are the lipases. This will lead to focal fat destruction, and as you know, the pancreas is surrounded by fat in the abdomen, and these lipases will digest this fat. Upon digestion of the fat, this will release the fatty acids, which will combine with calcium because it has a high binding capacity to calcium, the released fatty acids, in a process that we call it saponification, اللي بتؤدي لظهور الشوكي white material على الفاتي tissue زي ما انتم شايفين بالصورة. Under the microscope, طبعا this is the macroscopic appearance. Under the microscope, we have the shadow of cells with dead cells with lost nuclei. The last type of necrosis, we call it fibrinoid necrosis, and this type of necrosis is peculiar because it is only visible by the microscope. We can't see it grossly or by naked eye. It is caused by deposits of the antigen antibody complexes accompanied by fibrin in the walls of the blood vessels in cases of vasculitis, which is an autoimmune disease. One example is the polyarteritis nodosa. As you can see here, the fibrin material is the pink ring-like material deposited in the wall of this blood vessel. Also, it can be seen in cases of severe hypertension. And thank you for listening.